We will now continue our deliberations on agenda item 5E, Action Plan for the Health Sector Response to Viral Hepatitis in the WHO European Region. The relevant document is EUR/RC66/10. The draft resolution can be found in document EUR/RC66, Conference Doc 6, Revision 1, and the financial implications are in document EUR/RC66/10, Addendum 1. Viral hepatitis is a major public health threat in the WHO European region, responsible for more than 171 deaths each year, mostly due to chronic hepatitis B and C complications. We have now in front of us the first action plan for the health sector response to viral hepatitis in our region. The action plan advocates for coordinated, comprehensive, and integrated people-centered health systems response to viral hepatitis. In this session, we consider the action plan for the health sector response to viral hepatitis in the WHO European region, its visions, goals, and targets, and call for adoption of the resolution. I give the floor to Dr. Nedret Amir Hablo, Director, Division of Health Emergencies and Communicable Diseases, to give a brief introduction. Dr. Amir Hablo, you have the floor.
Thank you very much, Madam President. Yet another presentation from me, and I promise this is the last one. And now I'm honored to be presenting the first ever action plan on viral hepatitis in Europe. Chronic viral hepatitis is a major public health threat in the region, and it's responsible for over 170,000 deaths each year. It's about 400 every day, mostly due to chronic hepatitis B and C related liver disease. And as we have discussed in the previous session, there is a lot of co-infection with the HIV, which makes it even more serious. We estimate that 1 in every 50 people are affected by chronic hepatitis B and C, and unfortunately, most are unaware of their infection, and if not treated, are at risk of developing liver cirrhosis or cancer. And we see a different epidemiology in the region, whereas in many countries in Southern and Eastern Europe and Central Asia, prevalence is relatively high compared to the northern part. And with evidence-informed prevention, interventions, and the new treatment options, most of these deaths and the disease are preventable. So we believe inaction is no longer acceptable. And globally, we see a big change now how the international community is addressing and recognizing the burden of viral hepatitis. In May this year, the World Health Assembly adopted the Global Action Plan, Global Strategy on Viral Hepatitis, and committing to combat the viral hepatitis to reach elimination by 2030, an ambitious goal. And this European Action Plan adapts the global strategy in the European context and is aligned with the Sustainable Development Goals and Health 2020 and has close linkages with the HIV Action Plan as well as the Vaccine Action Plan, which has been endorsed by the Regional Committee in the previous years. The vision is a WHO European region in which the transmission of new viral hepatitis infection is halted, testing is accessible, and people living with chronic viral hepatitis have access to care and affordable and effective treatment. As I mentioned, our goal is aligned with the global goal of elimination by 2030, and we have targets beneath that by reduction of transmission, reduction in morbidity and mortality, and ensuring equitable access to comprehensive prevention, recommended testing, care, and treatment services for all. It also has 3 organizing frameworks similar to HIV, taking the universal health coverage, continuum of services, and the promotion of public health approach as the action areas. Let me now introduce some of the priorities within the strategic directions. And I would like to remind you that each strategic area has priority actions both for WHO as well as member states. The first one is focusing on the information and the need to generate and use high-quality strategic information in all the actions, in development of national plans, which is addressing the national and local context, including epidemiology, as well as design of the urgent and accelerated implementation of the action plan and advocacy for political commitment. Strategic 2 is describing the essential package of accessible and affordable interventions that need to be delivered along the continuum of hepatitis services and takes the full cycle of prevention, diagnosis, treatment, and care as the ideal model, depending again on the financial situation of each country and the epidemiology. So we encourage member states to identify the country's strategic specific interventions relevant to the local context and define their national targets aligned with the regional ones. So you will see that the approach here compared to HIV is quite moderate and depending on the epidemiology and the resources available within the countries, taking a stepwise approach. Strategic 3 identifies the best methods and approaches for delivering the continuum of hepatitis services, again looking into the different populations and different locations and taking again a vulnerable and key population approach, but still with the underlying principles of equity and maximizing the impact and ensuring the quality. And of course, as one of the important components is the involvement of community and people with viral hepatitis and civil engagement of civil society. Strategic direction 4 is financing for sustainability, which is not that easy for every country, considering the cost of the diagnostics and treatment, but trying to identify the best financing model for which is best for the country within the health system response. And also, I would like to inform you that WHO is working in partnership in looking into the options of reducing cost, particularly for diagnosis and treatment. And then this could be possible when integrated and linked services are delivered under a model of universal health coverage. So again, we are suggesting integrated patient-centered delivery models. 5 is innovation for acceleration. Still, there is more that we need to learn from the fight against hepatitis, and major gaps in knowledge and technologies call for particularly operational research in collaboration between the researchers and the policymakers, and to ensure that the research gets into the policies and translated into action. There is a resolution in front of you calling for, again, member states and secretariat commitments. And thank you very much for your attention and looking forward to your comments both to the action plan and the resolution which is in front of you.
Thank you very much, Dr. Amir Hablo. And I now would like to invite Dr. Amiran Gram-Krelitze, SCRC member from Georgia, to give the views of the Standing Committee. The floor is yours.
Thank you. Madam Chair, Madam Regional Director, Your Excellencies Ministers, dear ladies and gentlemen. On behalf of 23rd Standing Committee of the Regional Committee, I am pleased to welcome the Action Plan for the Health Sector Response to Viral Hepatitis in the WHO European region. I acknowledge that the feedback and advice from our previous sessions has been well considered in the current version presented to this session of the Regional Committee. The European Action Plan has been developed through a truly region-wide participatory process, guided by the Advisory Committee established to assure an accurate technical review. Feedback has been sought from all member states, major partners and civil society, including patients' organizations, and through a broad public web consultation to ensure the action plan takes into account the context of the WHO European region and recognize the diversity in the epidemiology and burden of viral hepatitis across the region, as well as diversity in organization and the health systems and available resources. The ambitious yet achievable vision and goal of the action plan, elimination of viral hepatitis as a public health threat by 2030 in the region, will help countries achieve the commitments of the 2030 Agenda for Sustainable Development, the first even global health sector strategy on the viral hepatitis for 2016-2021, adopted by the 66th World Health Assembly earlier in May this year, and Health 2020, the European Policy for Health and Well-being. Providing a comprehensive framework for the health sector response, this action plan shall guide member states in developing country-specific national viral hepatitis strategy and plans, taking into account local context and available resources. There are substantial challenges in many member states on the way to scaling up the national response to ensuring equitable access to prevention, interventions, diagnosis and treatment. Overcoming this will need an ongoing political commitment and resource mobilization at the highest level, multi-sectoral involvement and strong partnerships. There are some good examples of such commitment in a number of member states, even where resources are limited. Ukraine and Kyrgyzstan are updating their national strategies that already will be in the line with the regional action plan. Serbia, Tajikistan, and many others are also developing comprehensive action plans. Georgia, my own country, is making a great progress in implementing its national program aiming at the elimination of hepatitis C by 2020, and the details will be presented later on by our minister. On behalf of 23rd Standing Committee of the Regional Committee, I would like to recommend the presented action plan for adoption by this regional committee through the endorsement of the related resolution. Thank you.
Thank you very much. And I now open the floor for the debate and ask delegates wishing to speak on the issues raised under this agenda item, please to raise their nameplates. Georgia, you have the floor.
Thank you very much. Georgia welcomes elaboration of strategic action plan for hepatitis C and considers it as very timely and important document to combat with this disease. Also, Georgia has some experience in this field. By one hand, we have very unfortunate experience with very high incidence of this disease. 7.7% of adult population is infected, and 5.7% out of them in active stage and requires treatment. By other hand, we've got unique opportunity from April of last year to start elimination of hepatitis C project when pharmaceutical company provided to us the medicine with absolutely negotiable price, and I'd like to express our gratitude to that company, to US CDC and to WHO, our partners. With partnership, we could start this extremely ambitious project, and we are going to treat 150 1,000 patients. Within very limited period of time from last April, we already engaged more than 15,000 patients in this project, and more than 8,000 patients out of them has been accomplished the treatment prescription with more than 90% of success. And I think this is very big achievement, and Georgia is very committed to share experience regarding this, share our knowledge and experience with other state members and with our partners. And even we've got some unique opportunity when a majority of dominant of medicine price has been literally eliminated. We found extremely important approaches for this project, because unlike HIV's project, when early treatment is prevention itself, in case of hepatitis C, unfortunately, early treatment not always possible because of several reasons, and because we started elaboration of our strategic plan by 3 vector approaches: treatment itself, prevention, very strong prevention, and minimizing of new cases, and what is extremely important, patient education with 3 points. One is stigma. When we were starting this project in April, as I said, we could not find even one single patient that would agree to share his or her experience with society and support this project. After launching of this project, and especially after accomplishing of first prescriptions, now we are having partners with existing and former patients, and hundreds of them are not only our warm supporters, but very active members and partners of this project. And I think this is extremely important. Equally important is treatment. Also patient education, healthy lifestyle, because a lot of people were thinking that just getting medicine is enough to eliminate disease, while healthy lifestyle is extremely important. And I think by this kind of approach, we are ready to continue this very ambitious project, and even it sounds extremely ambitious, elimination of hepatitis C. We believe that with our partnership and together, we could tackle this historical process. Thank you very much.
Thank you very much. And I now give the floor to Germany, followed by Tajikistan.
Okay, we just leave it on. Ja, danke, Frau Vorsitzende.
Thank you, Madam President. Germany applauds the first action plan for the health sector response to viral hepatitis in the WHO European region. This is something we very much welcome. This plan gives guidance to member states on how to elaborate national strategies that would take due account of the national context and would therefore be specific to their needs. We welcome this flexibility, which makes it possible to adapt plans accordingly, and also makes it possible to roll out strategies and plans that take due account of the availability of resources in different states in the European region. For Germany, we have adopted an integrated strategy for hepatitis B, C, and other STIs, and this was actually adopted at federal level earlier this year. This strategy is one that includes a number of elements, including a number of points from WHO strategies on HIV/AIDS and hepatitis, and it also seeks to strengthen the work we do with particular high-risk groups. We have laid emphasis on prevention, diagnosis, testing, and care. Early detection and prevention are also areas that have been expanded within this new German strategy. We are convinced that the European Action Plan will make it possible for us to give a fresh impetus to implementation of Germany's national strategy. We know that the European Office will do its utmost to assist countries in implementing this action plan, and we very much hope that this will make it possible to strengthen health systems and thereby to curb the spread of hepatitis B and C, and also HIV/AIDS and other co-infections such as tuberculosis or STIs. We would also like to underscore the need to overcome any discrimination that may exist or any attempt to stigmatize particular groups, and we need to meet that challenge through properly targeted measures. We are sure that the action plan before us will make a contribution to preserving public health throughout our region and will allow us to fight against the threat of viral hepatitis. Therefore, we support the resolution and the action plan. There's another very important point I'd like to mention. We would just like to add something to operative paragraph 2. And I will read out in English our proposed change.
Add in the resolution under OP2D, after policies, the words as well as discriminatory environments. So OP2D would read, to address regulations and policies as well as discriminatory environments, and the rest would remain the same. Thank you.
Thank you very much, Germany. And I now give the floor to Tajikistan, followed by Italy.
Thank you, Regional Director. Madam President, Tajikistan welcomes the elaboration of this document. A document is intended to eradicate viral hepatitis in the WHO European region. That is our goal. Our country has already achieved some success in this fight, thanks to the fact that we have been able to implement a relevant vaccination program. And indeed, we introduced the vaccine in Tajikistan in 2008, and we have now been able to extend its use. And indeed, the plan that we have is one that has been further extended. We have been able then to undertake a number of studies that have demonstrated the fact that the vaccination program we have has been particularly successful. And indeed, in the decade of implementation of this plan, we have seen that in fact 6.8% has been the figure for the drop of viral hepatitis in our country. And particularly, we have been able, thanks to a number of studies, to publish the results that have been achieved in relevant medical journals. And you can see the details of it all there. When it comes to this vaccination program, then we set various goals intended to prevent the spread of viral hepatitis, and we have been able to do that. And we have now seen that we have set an example that demonstrates the fact that if you do have appropriately targeted vaccination, then you can reduce morbidities, even in countries where there are very high levels of morbidities at present. And we very much hope that this plan of action will make a significant contribution to further attempts to combat the spread of viral hepatitis in our region. Thank you.
Thank you very much, Tajikistan, and now give the floor to Italy, followed by the Russian Federation.
Thank you, Chair. The fight against B hepatitis is based on vaccination. Vaccination. C hepatitis, though, is rather more complex. While endorsing the action plan, we underline the need to liaise with the new initiative on innovative medicines, keeping their costs under control, thus ensuring financial sustainability and move from the current restrictive protocols providing life-saving treatment only to serious and advanced cases. We need to make C hepatitis treatment available to all, irrespective of their classification, as treatment is the key action to stop viral circulation and eradicate it. We also underline the need to address co-infections as well as the sometimes persisting risk factors. Medicines treat the disease, but do not prevent further infections, should risk factors and behaviors remain unaddressed. We have currently over 60,000 patients under treatment, and a specific fund is being reserved by a minister's initiative to reach out another estimated 60,000 eligible individuals. We emphasize the opportunity to build the economic case in support of extensive and universal treatment, but also preventing criminal fake drugs trade and illicit reselling of drugs of uncertain origin getting into our countries via new smuggling routes. We are alarmed not only by the report of several hundred patients already under possibly fake treatment, but mainly by the almost inevitable drug resistance being introduced in the region unless countries collaborate collectively to combating actively against smuggling and unregulated market, and urge the European Office to advocate and promote enforced regulations with other regional offices and globally. Thank you.
Thank you very much, Italy, and I give the floor to the Russian Federation, followed by Azerbaijan.
Distinguished Regional Director, Chair, colleagues, the Russian Federation would like to thank the WHO Euro Secretariat for their work in preparing this very important and timely document. We'd like to point out that in the Russian Federation we're carrying out a number of measures for the prevention of viral hepatitis, and particularly hepatitis B, through vaccinations up to 55 years of age. This will enable us to bring our morbidity down to a minimum and to prevent vertical transmission, mother-to-child transmission. We have vaccinated over 70 million adults and children over the last few years. We have seen some very highly professional development of prophylactic and preventive measures in the light of the present hepatitis epidemic situation. However, we feel it would be useful to add to the draft resolution, the first paragraph of the second page, the following amendment: adapted to national priorities, legislation, and specific contexts. This wording was agreed by countries earlier, as has been said earlier. During the 69th WHA in May, a resolution was adopted on the approved third strategy and HIV, hepatitis, and STIs control. We call on states to support this proposal. Including such wording will enable us to expand our plans in the light of national priorities, conditions, and also national legislation. As an example, the Russian Federation feels that when it comes to measures to control hepatitis, we need to pay more attention to matters relating to blood products, their production, and blood substitutes, as parenteral transmission remains relevant, and at the same time, these products are vital in the case of medical care during resuscitation. Similarly, we give priority not only to prevention among key population groups, but also to primary prevention, information to citizens on health matters, a healthy lifestyle, on the risks of casual sex in the transmission of viral hepatitis, stressing family values. We understand the importance of adopting this action plan on hepatitis control, so Russia on the whole can support it together with our amendments and comments. Thank you.
Thank you very much, Russian Federation, and I now give the floor to Azerbaijan, followed by Austria.
Regional Director, Madam President, we support the work that is being done in seeking to combat viral hepatitis in the WHO European region and the action plan. We have some experience in Armenia in this area, and I'd like to note the fact that we have a state program on hepatitis, and that is intended to improve the health and vulnerability of all. And in the course of implementation of that plan, we, last year, established a commission to focus particularly on hepatitis B and C, and this looks at diagnosis, prevention, and treatment. As well as that, we have a database. And indeed, going back to 2005, at that time, we were also able to ensure that we have allocated every year sufficient resources to this particular area of work. Thank you for your attention.
Thank you very much. And Azerbaijan, and now I give the floor to Austria, followed by the Netherlands.
Frau Vorsitzende, Frau Regionaldirektorin.
Thank you, Madam President, Madam Regional Director. Austria would like to welcome this plan, the action plan for the health sector response to viral hepatitis in the WHO European region, and we support the corresponding resolution. We know that chronic hepatitis requires intensive treatment, and that means that we have to redouble our efforts in this regard. Thanks are due to Euro for having emphasized the need to fight against viral hepatitis and the fact they've made this a priority for the European region. This resolution complements others that have already been adopted at global level. As we see it, preventing transmission of STIs is something that needs to be underscored at European level also if we are truly going to fight against the transmission of viral hepatitis. We really need to focus on preventing STI transmission. In Austria, in recent years, we have modified the therapeutic protocol that we have in this field, and we have established a system of detecting infections related to hepatitis B and hepatitis C. And also, we test neonates immediately after birth. We do that in order to ensure that we do not have a double detection burden. That being so, we also have a framework for tracking following detection, and we work very closely with the European Centre in that regard. A number of indicators have to be defined if we are to be successful in undertaking this kind of approach in future. We also need to think about having a molecular surveillance network set up. That might be an appropriate approach. We have a number of preventive measures that we also think need to be properly coordinated with work done in other areas. Thank you.
Thank you very much, Austria. And I now give the floor to the Netherlands, followed by Latvia.
Thank you, Chair. The Netherlands would like to commend the WHO Secretariat with this action plan. With about 500 people dying each year, viral hepatitis is a bigger cause of death in the Netherlands than HIV/AIDS. It is estimated that in the Netherlands there are about 40,000 people with chronic HBV infection and 20,000 people with chronic HCV infection. It seems to be difficult for the Dutch healthcare providers to reduce the burden of disease and the number of deaths caused by viral hepatitis. Against this background, the Dutch Minister of Health has invited the National Public Health Institute to consult all relevant stakeholders and to develop a broadly supported action plan with the aim of better combating hepatitis B and C. Between October 2014 and June 2016, an expert group has drafted a national action plan on viral hepatitis. After analyzing the causes of the current standstill, several interventions have been identified that should lead to better results. These interventions are in the domain of awareness, prevention, detection and treatment, and last but not least, in the way healthcare for hepatitis patients is organized. The final point I would like to make has to do with the price of medication. In recent years, new pharmaceuticals for hepatitis C have become available. They are both very effective and very expensive, at least 60,000 euro per treatment. As these pharmaceuticals are included in the basic health insurance package, they are available to every Dutch citizen in need of them. The issue of high prices of pharmaceutical treatment is high on the political agenda of the Netherlands government. One of the priorities of the recent Netherlands EU presidency was the reduction of prices of pharmaceuticals. This resulted in the adoption of Council conclusions on strengthening the balance in the pharmaceutical systems in the EU and its member states. These Council conclusions are a first step in defining cooperation in dealing with high prices of medicines in the European Union, and we hope that more joint steps by member states will be taken to guarantee access to medicines for all. Thank you.
Thank you very much to the Netherlands, and I now give the floor to Latvia.
Latvia would like to express its full support to the proposed European Action Plan for the health sector response to viral hepatitis and the relevant resolution. Viral hepatitis has long been left without attention and response has been insufficient, despite the fact it represents a considerable burden in many member states, including Latvia. The prevalence of hepatitis C virus in our population is 2%. Thus, hepatitis C treatment has become one of the priorities for Latvia. Last year, government granted additional funding for hepatitis C treatment. Starting from 1st January 2016, hepatitis C treatment is fully covered by the state. The first months of this year have showed that the number of patients who have expressed the willingness to treat has sharply increased. Latvia also has set up the hepatitis C register. With the prevention tools that are available and effective medicines that can save thousands of lives, we welcome the goal of elimination of viral hepatitis as a public health threat in the WHO European region. We acknowledge the challenges that Latvia and many other countries are facing in order to ensure access to life-saving medicines for all who are in need, and looking forward to a better cooperation of countries in the region aimed to reduce prices for treatment and ensure access for treatment to all. Thank you.
Thank you very much, Latvia. I have no more member states wishing to take the floor. So we will move to NGOs, and I now call on the representative of the World Hepatitis Alliance. You have the floor.
Thank you, Chair, for the opportunity to address this meeting, which I do on behalf of the European Liver Patients Association and the World Hepatitis Alliance, that represent the roughly 30 million people living with chronic viral hepatitis in this region. Regional Director, distinguished delegates, as you know, with the notable exception of hepatitis B vaccination, government action to tackle viral hepatitis has been slow in coming. In May, this was recognised with the adoption by the World Health Assembly of the first ever global health sector strategy on viral hepatitis, with its all-important goal of the elimination of hepatitis B and C as a public health concern by 2030. Now we have an excellent roadmap to help member states translate that strategy into a European context in the form of this regional action plan, for which I would like to commend the Secretariat. I urge you to adopt it. We have waited many years for such an action plan. Indeed, many of us have died and are still dying, waiting for the concrete action this plan sets out. In this region in particular, as the Director General said this morning, viral hepatitis disproportionately affects marginalised and stigmatised populations. Turning this regional action plan into action through the development and implementation of comprehensive national plans for all those affected is therefore another perfect opportunity to show that the SDG promise to address inequity, not to leave anyone behind, is more than words, is in fact a real commitment. Please be assured that civil society will do all it can to support member states to implement this regional plan through initiatives like the global No HEP elimination movement and the European HEP core study. Thank you for your attention.
Thank you very much. And I give now the floor to Dr. Amir Hablo to respond to the comments and questions raised.
Thank you once more for your support and commitment to implement the action plan, and also acknowledging the priority areas as well as the challenges we are going to collectively face. Let me start by congratulating actually Georgia being the only country with an elimination target. We are working together and learning a lot from your experience. And a number of countries have been sharing their experiences and the process of development of the national plans, like Germany on giving the focus on prevention and strengthening health systems, and also addressing the co-infections, which is in the core of the plan. And actually, one area I'd like to clarify is in the regional plan, we have been also addressing the sexually transmitted infections, which is also a comment by Austria. it also has cross-reference to HIV, and at the same time HIV plan also addressing the STIs, and that's the way we would like to address the STI and the congenital syphilis in the region. A number of countries had shared their successful experiences with the immunization. Welcoming Tajikistan, we have learned a lot from the studies we have done on the impact of vaccination, as well as agreeing with the comment from Italy. In hepatitis B could be relatively easy, but C is a complex issue, and fully agree that, and also as addressed by other countries, we have to work together to look into the price and sustainability of the program. In that aspect, I'd like to remind you that the regional office is working also with headquarters, and there was a technical briefing on addressing the newly high-priced medicines. I think that requires a collaboration. We are committed to work with you and sharing the experiences. And one of the concrete actions we could see is sharing data, information, and transparency makes a huge difference. Thanks to Russia, the Russian Federation, we note your amendment, and also the blood products and the substitutes addressing them are in the plan. And thanks to Netherlands and as well as Latvia for sharing your experiences. So we are looking forward to working with you in now the next stage of the implementation, and we see that as a first step to address this high public health burden in the region.
Thank you very much. We can now consider the adoption of the draft resolution as contained in document EUR RC65 Conference Doc 6 Ref 1. And we heard one amendment from Germany, and I kindly ask my rapporteur next to me to read this amendment out.
So in the operative paragraph 2D, beginning with to address regulations, Germany suggested the change after the word policies and before word that to add the words as well as discriminatory environments. So the paragraph reads, to address regulations and policies as well as discriminatory environments that prevent access to comprehensive prevention, treatment and care of viral hepatitis.
Thank you very much. Is the committee willing to adopt the proposed draft resolution with the amendment by consensus? I see no objection. The resolution is therefore adopted.